Based on the data that we have obtained, I think it's too early days for that, for a couple of reasons. We're just starting to, I think, understand what the different genetic and protein landscape is in those early stages, and I think what we need to do is clearly define the ones that are really at high risk of developing progression into CLL or lymphoma, for that matter. So I think based on what I've shown, yes, there could be potential for thinking that direction, but then really if we use those data for defining high-risk groups, but still I think in MBL, as opposed to, for example, in myeloma, smoldering myeloma, or maybe even with CCAS, I think it's a bit difficult to see how this would evolve, knowing that the aggressiveness of the disease is different, such that it will take longer before it finally develops into a malignancy. And so, yeah, there's another balance to be taken there, or consideration to be made on the anxiety of starting to treat versus the benefit of that treatment.